So the flu, what's new with the flu this year?
Well, activity is really picking up in the last few weeks. We also announced, unfortunately, that a woman in Santa Fe died from the flu, and so we want people to be aware that it's a great time, if they haven't been vaccinated, for anyone 6 months and older to really consider getting the vaccination.
Now, Doctor, I got my flu vaccination 6 years ago, so I'm good, right?
Every year.
Every year, dang it. Okay.
Yeah, the flu changes, the viruses that circulate change every year. We base the vaccines on what's circulating, what we think will be circulating every season, so it's really important to continue to get them every year, particularly if you're in risk categories that are going to put you in a situation where you might have severe complications and even death from it.
Okay, well now, I am shot adverse. I don't like people sticking pieces of metal into my body. What are some of the other options folks have for flu vaccinations?
It's great these days because there are a lot of options. Depends on your age and certain circumstances related to the individual, but you can get a nasal spray. You're young enough to still be able to do that, I suspect.
God bless you.
And you can get a needle that goes just right under the skin instead of all the way into the muscle. So there are a number of options depending on your age.
Fantastic. Now, once you get the flu vaccination, it takes a little while for that vaccination to become effective, correct? Exactly
right. It takes a full 2 weeks for it to be fully effective, so you want to be particularly careful while you're waiting for it to kick in. The other thing to be aware of, it's not 100% effective, so it's still good to think about other prevention methods that are available to us, including a secondary line of defense, which if you do get the flu, if you've had the vaccine, it might be a lot less severe, but it's still important to really think about it and to ask if you should have antiviral medications. And really the only way to do that is to be seen as quickly as possible, because getting them started within the first couple days is the best approach, but they can be life-saving also.
Now, there's maybe some confusion that folks have, that they're starting to not feel too well, fever, body aches, things like that. How do you know if it's the flu or if it's just a cold?
It's really very, very difficult, although frequently flu hits you pretty hard. You feel pretty lethargic, pretty achy. You can have a fever, whereas frequently with a cold from other viruses, it might not hit you as hard. But you can't really know for sure, and if you're in one of these groups that might be severely affected by flu, it's really a good idea to see a healthcare provider if at all possible.
And they can do an examination and determine if antivirals are necessary, or bed rest, or whatever else.
Exactly.